Hi there guys, welcome back. Okay, cool. So I'm going to talk about my disability now. I'm going to give you some more insights on what happened, where, how and what. So 2015, it was a Wednesday. I was involved in a motorcycle accident where I broke my neck and my back. The doctor said that my damages came from the person that took my helmet off. So always remember, when you see somebody in a motorcycle accident, be careful of that helmet. It's honestly a lifesaver. But we can't cry about that. I can imagine there was a lot of blood and there was a lot of chaos, and the people were just trying to help. So I broke my neck and back, C45T12, which were both fused, and spent 2.5 months in hospital at Sunnyhill. After that, I went to a step-down facility where I spent another 2 or 3 months, I can't remember, and they basically teach you how to work with your new body. How to roll, how to sit up, how to function, how to also use a catheter, how to be a new person with your new body. All right, so bowel and bladder function is obviously compromised with spinal cord injury. I have no bowel control or no bladder control, so I use a catheter every day to wee, and I use that every time I need to wee. Insert it through the penis into my bladder, and then I wee. And luckily I don't have full feeling there, so it's not as painful as it would for a normal person. What I also do is I do Botox twice a year. So the Botox helps, just relaxes the bladder so it can stretch more, so it can hold more capacity. I also sleep with a diaper every night like a little baby, but that's part of it, I suppose, just in case an accident does happen. And now and again it does happen, so part of life, I suppose. And then during the day I'll use a pad. I wear a pad over my underwear or under my underwear, just to make sure that there's no leakage. And these are basic things. These are things that I'm so used to by now that it's become part of who I am and what I do. Okay, so bowel control. I insert a suppository, sit on the toilet and wait for my bowel to move. Happens quite quickly. It used to be quite a serious process, an ugly process, but it's become a lot easier. The trick there is just water, water, water. The more fluids you use, the better your bowels move, and it just makes the flow a lot easier. Okay, cool. You'll also see my breathing. My breathing it looks like I'm out of breath the whole time, and that's because my lungs are partially paralyzed with my diaphragm. So my abs don't work as well as they should, so they can't move inwards, subtract, and move my lungs up. So I have to move my lungs up through breathing like this. So that's, if you've ever seen me breathe, you'll see I breathe like that. I also, when you see me at gym, my stomach bulges quite a bit, and that's because there aren't a lot of control with my abs. That has become a lot better in the last few months, especially because I've lost a lot of weight, and I'm practicing. I'm trying to work on those abs as often as I can. Like you guys saw in that video, I can do a full sit-up. A year ago I couldn't do a full sit-up at all. So it's important for the people out there that are training, that are in a wheelchair. Training is so important, like I said before, not just for your body but for your mind. But it's been part of my life for 10 years now. Anything from 3 days a week doing 3 sessions a day, to every day of the week doing 1 session. I've moved it back to 3 days a week now, where I exercise Monday, Tuesday, or Monday, Wednesday and Friday. And currently doing the boxing, currently doing the gym. I'm going to add another physio session to that, hopefully, and that makes a big difference. That's changed my life. It's important to be as active as you can. You'll see that my right side is a lot more compromised than my left side because of the quadriplegia. And what the quadriplegia is, it's just the height of your lesion where you basically got hurt, and that's why my right side is completely more affected than my left. Cool. That's a quick breakdown of the disability and how it works. If there are any questions you have, drop them in the comments, like this post, and I'll chat to you guys again soon. Take care.